The increasing legalization of cannabis across the United States has created a dangerous illusion that the substance is completely safe, but new research strongly suggests otherwise. Recent studies have found that marijuana use could significantly increase the risk of severe cardiac events, even in young and otherwise healthy individuals. The findings indicate that cannabis users under the age of 50 are over 6 times more likely to experience a heart attack compared to non-users. Additionally, they are 4 times more likely to suffer a stroke, twice as likely to develop heart failure, and 3 times more likely to die from a cardiac event. These alarming statistics reveal that cannabis is far from the harmless drug many assume it to be. One of the most disturbing aspects of the study is that these risks begin to peak as soon as 1 hour after consumption. This suggests an immediate and acute effect on the cardiovascular system. Yet many users remain unaware of these dangers. Despite the widespread belief that marijuana is a safer alternative to substances like tobacco, the research points to a significant risk to heart health that cannot be ignored. While the exact mechanism behind this increased risk is still being studied, researchers suspect that cannabis may disrupt heart rhythm, increase oxygen demand in the heart, and impair blood vessel function. This combination can lead to restricted blood flow and, ultimately, catastrophic cardiac events. Adding to the concern is the fact that the participants in these studies had no prior heart conditions, did not use tobacco, and had otherwise normal cholesterol and blood pressure levels. This means that even individuals who consider themselves to be in good health are not immune to the dangers of cannabis use. The assumption that marijuana is only risky for those with pre-existing conditions is simply not supported by the data. In reality, the drug poses a substantial threat to even the most unsuspecting users. Another critical issue is the lack of awareness surrounding these risks. Cannabis consumption has surged in recent years, fueled by relaxed regulations and aggressive marketing that downplays potential harms. Unlike tobacco products, which carry clear and prominent health warnings, marijuana is often presented as a natural, therapeutic substance with few drawbacks. This misconception is particularly dangerous for younger users, who may believe they are engaging in a relatively low-risk activity when, in fact, they're significantly increasing their likelihood of a life-threatening cardiac event. Despite the troubling findings, there is still considerable resistance to acknowledging the risks associated with cannabis. Some researchers caution that the studies have limitations, such as potential confounding factors like co-use of other substances. However, the sheer size of the data, spanning millions of individuals, strongly suggests that the association between cannabis and heart disease is real and concerning. Even if further studies are needed to fully understand the extent of the danger, the current evidence is more than enough to justify extreme caution. Health professionals are now urging policymakers to take action before the situation worsens. At a minimum, cannabis products should come with clear warnings about the potential cardiovascular risks, much like cigarette packaging. Doctors should routinely ask patients about cannabis use as part of their cardiovascular risk assessments, rather than assuming that only tobacco and alcohol use are relevant factors. If these warnings are ignored, the consequences could be devastating. The reality is that cannabis is not the harmless drug that many believe it to be. The findings from these studies should serve as a wake-up call for users, healthcare providers, and legislators alike. Without immediate efforts to educate the public and implement stronger safety measures, the growing use of cannabis could lead to an unexpected public health crisis. The assumption that legalization equates to safety is proving to be a dangerous misconception, one that could cost lives if left unaddressed.